Hey, what is this?
This is a biopsy specimen of radicular cyst.
Radicular cyst? What is it?
Radicular cyst is an inflammatory cyst. It is considered as the most common odontogenic cyst. It is also known as periapical cyst, apical periodontal cyst, or root end cyst.
Oh, why is it called a root and cyst?
As you can see in the specimen, it occurs around the apex of a tooth. Here, the flag A represents the root apex of the affected tooth and B represents the cystic cavity.
Oh, in which age group does this mostly occur?
Peak age for incidence is 3rd, 4th, and 5th decade, with a slight male predilection.
Where does radicular cyst mostly occurs?
Maxilla is 3 times more affected than mandible, and this specimen is of maxillary right for smaller.
How does radicular cyst appears clinically?
It is asymptomatic and also slowly enlarging cyst, hard bony swelling initially, later if the cyst breaks through the cortical plate, it becomes fluctuant. The associated tooth will be non-vital. Movement and mobility of the adjacent tooth as cyst enlarges.
In this specimen, we can see cystic capsule with attached root stems, brown in color, smooth to rough surface and firm in consistency, measuring approximately 2.5 into 3 into 1.2 cm. The cystic fluid is watery and opalescent, usually brownish. It can be gold or straw color due to presence of cholesterol crystals. They originate from disintegrating RBC as a result of inflammation.
This is the microscopic view of cholesterol crystals. Histologically, it appears as needle-shaped clefts.
So, what about radiographic features?
It is identical to the periapical granuloma but greater in size. A round radiolucency encircles the apex of the tooth. Occasionally exhibits radio-opaque line around the periphery of the radiolucent area.
I want to learn more about histology. Come, let's see it under microscope.
Okay.
Wait, Shrikant sir is seeing the slide. I think sir can describe you better.
Yes, let's go and ask him.
This is the cystic lining. You can see that underneath the cystic lining you have a inflamed connective tissue capsule, and you can see the epithelium is intermittent. Below you can see the epithelium, above you cannot see the epithelium, right? And then as you follow the cystic capsule, you can see that the epithelium, some areas are thicker, some areas are thinner, and it is separating out from the epithelium also, from the underlying connective tissue also. So if you follow the lining down under, you will find there is thickening of the epithelium like this, and then you can see some cystic capsule which is showing inflammation. See, epithelial lining with lot of inflammatory cells here. All these are inflammatory cells underlying. Okay, see the lining, the lumen is empty, epithelium is non-keratinized, right? Lot of areas of inflammation leads to this kind of areas where blood may be collected. This is what leads to cholesterol clefts and cholesterol crystals later on.
So, how is this condition treated?
Root canal treatment with episectomy or extraction of the non-vital tooth with curettage of the apical region. Surgery is done in the case of persistent lesion.
It was nice learning about this pathology. Thank you.